All right. Good afternoon, and thank you for doing this interview with us. My name is Rahul, and I'm the head writer for 72 Dragons. We are a production company based in Hong Kong, and we also have Dr. Pietro on the call. Dr. Pietro.
Hi, Chinomso. So welcome. It's a pleasure to have you with us. Chinomso is the founder of Traffina Foundation and a partner with Zero Mother's Day. So we know that Traffina Foundation is a non-profit organization. Let's talk a bit about the foundation to introduce it to our audience and its connection with Zero Mother's Day.
Thank you. Thank you very much, Dr. Pietro. Yes, Traffina Foundation for Community Health. It's a non-governmental, non-profit organization that's been in existence over the past 10 years now. Well, I'm from Nigeria, so Traffina Foundation is a local organization in Nigeria promoting maternal and child health. We've been at the front line improving quality of care for pregnant women because of the high maternal and child mortality rate in my country, which is really a very worrisome reputation and a burden to people like me. So we started it to fight against that and to make sure that we provide every help and support needed to save the lives of Nigerian women and children. And in the course of our work, we've met amazing people like Dr. Veronique, who was part of Zero Mothers Die, and we've done a couple of work together. And Zero Mothers Die also being an organization promoting quality of care for women and children too. So we have a strong bond and vision together to ensure that we help our women to survive during pregnancy and childbirth.
Great. It sounds like an amazing work you both are doing for maternal mortality.
You are the founder of Traffina Foundation, and this foundation has come a very long way when it comes to helping and providing service to all the people in the community. What was your inspiration, and how did you start this foundation, and what was the vision, or what is the vision of Traffina Foundation?
Traffina Foundation's vision always have a connection with my mother. My mom had terrible childbirth complications during her time of conception and childbirth. We are 5 in my family, and 3 of us out of the 5 kids that she had, gave her terrible complications from excessive bleeding to many other complications. And my mom, during their own time, they didn't really have access to good care, to quality care. During my own time when she was pregnant, last childbirth, she lost count of her menstrual period, and she started having breast tenderness and swellings and all of that. She tried all traditional medicine because going to the hospital was not affordable for her. So, but eventually she went to see a doctor, which unfortunately made a wrong diagnosis and said she had some kind of breast diseases. And they booked her for surgery, cut off some part of her breast, then booked her for another surgery to take everything out. But then a woman decided to help and took her to a hospital and paid for everything. The woman just asked them to do a pregnancy test. And when they did, behold, my mom was pregnant and I happened to be the baby. It changed me from childhood, shaping my vision on how to help. It got me worried. I started thinking of going into the medical field. I decided to set up Traffina Foundation so I can help more women.
So we see that you at Traffina Foundation are joining hands with other organizations for help and support Can we talk a little bit more specifically about the connection your organization has with Zero Mothers Died, with other organizations, and what is this joint effort looking to achieve?
Zero Mothers Die, in particular, it's an organization that should really be applauded, because not just in Nigeria, in many other countries, they have been consistently providing help to women, especially Zero Mothers Die app. They say information is power. I'll come down to Nigeria, where we are doing our joint effort. Many women in Nigeria are dying because of cultural influences, but Zero Mothers Die app has created quality information out there so that women can be able to read and have the right knowledge. But this is what the bridge that Zero Mothers Die and Traffina is doing. In the app, from time of conception through the 9 months after the delivery, postpartum, every information that women need are there. And we have provided them with the Pidgin English translation, which the average Nigerian woman understands. These women are downloading this app and they're sitting at the comfort of their homes and reading it. They come to our DMs and ask questions. It's changing the narrative. It's changing the harmful cultural practices. And not just that, Zero Mothers Die also supports Traffina to provide the birth kits to give to the women so they can have a safe, childbirth whenever the time comes. So it's Zero Mothers Die and Traffina should really be applauded for this amazing app that is helping our women right now.
Can we talk a little bit about the birth kit? And I've also come across some images on your website wherein a lot of women are suing the birth kit actually. So what does that birth kit basically includes, and what is that birth kit?
Yeah, the idea of the birth kit started when I was in School of Midwifery. We had a lot of women coming in to have their babies with nothing. If the women do not come in with their listed birth supplies, they are being turned away. But when I did my research and I noticed that so many women who decided to give birth at home or decided to patronize the traditional birth attendants go there because of how cheap they are and because they don't bother them with list of birth supplies, and nobody turned them away. So in order to get the women to give birth at the health facility under the supervision of a trained birth attendant or a midwife, getting those birth kits for them was going to attract them, and is still attracting them. So I started putting them together. I go to the communities with my team and talk to them and say, hey, you don't have to go away anymore. We have this for you here, and it's for free. And it contains 15 disposable medical supplies, from gloves, from baby diapers, from receiving clothes, from cord clamps, from blades, from underlay pads, and placenta disposable bags, mucus extractors, everything needed for normal vaginal delivery. It's included there. And we also added misoprostol in it years back because of helping to prevent and manage postpartum hemorrhage. So they are aware that this is in this kit. When we give it to them by hand, we instruct them, do not open it. When you get to the doctor's office or to the nurse, hand them over this. They know what to do with that. We're almost going to run into millions of that distribution. And that has strengthened the confidence of women to come to the health facility to have their babies. And Zero Mothers Die have been part of it for a long time. We improve technology aspect. We also improve on the birth supply. So The birth supply is a lifesaver, I can tell you. It's a lifesaver. And we're hoping to help our women more with that.
Yeah, it's incredible because I see the Traffina Foundation and Zero Mother's Diet are doing work with technology, but also you also providing very practical help and support to the mothers by creating this kit. We'll be very curious also to know what are the future projects for Traffina Foundation and Zero Mother's Diet.
In our communities, we do monitoring and evaluation consistently to know the impact of the work that we are doing, to know how it's valued, to know how lives are being saved. One of the major things I would say here is the fact that the advocacy part of faith, it's bringing families together to support the pregnant woman. It's no longer the burden of the pregnant woman alone. We encourage the husbands to also download the app, read it together with your wife. They now know signs of labor. They now know causes of maternal deaths. They now know about immunizations, that they are not harmful. They now know when to remind their wives, to go and immunize the child. They now understand nutrition, because there are certain food they restrict pregnant women from eating when they are pregnant. They say, oh, it's going to make the child to drool. It's going to make the child's head to be big. No, these are the food that are very important. So we are seeing a whole lot of great impact, and women are coming in for antenatal care, because this is when they rule out the underlying disorders, rule out complications, and know what to do at the right time. So our women are attending the antenatal session 4 or 5 times. If there's any complication, we find it out on time and we refer them for quality care. And we're also training our health workers know the right way to talk to the women, because if you harsh at them, they're not going to come. They will just go away. So these things are being helpful. Lives are being saved. Children are meeting up to their 5-year birthdays, and great things are really happening. The impacts are really huge. And for future, we are looking forward to people have their phones, they download all manner of stuff, yes. But we want to infuse the right information. We want to save people's life. E-health is very important. We want to get more women in digital health. We want to get more women in tech. And then we want to spread the news through the women who have been impacted. So that is the vision, yes, to have every woman in Nigeria have access to the Zero Mothers Die app.
That's wonderful. The impact that the organizations are having in the community. It's really amazing how you also looking into cultural barriers that many other people might not take into account. So it's wonderful work.
Thank you.
Chinomso, it has been an honor and a privilege talking to you about the incredible work the Traffina Foundation and Zero Mother's Die is doing to ensure every mother has a successful pregnancy and avoid so many preventable deaths. Thank you so much.
Thank you. Thank you for having me here. And I want to say thank you to Traffina team, Zero Mother's Die team, Dr. Veronique, an amazing woman, and we're hoping to keep doing our best to save the lives of women in Nigeria and beyond. Thank you for having me once again.
Thank you.
Thank you.